Welcome to Yogayama's Yoga Prep course on the anatomy of yoga practice. In this course, you learn some basic musculoskeletal anatomy that will help you work in a more effective way that addresses limitations in the body. When we do yoga poses, there are three different ways that the body can be challenged or limited. One is a limitation in strength. The next is a limitation in range of motion, or how far you can move a particular joint. And the third is limitations in skill or understanding of how to do or what is happening in the body. With limitations with range of motion, bone shape, the quality of muscle, the quality of connective tissue are all factors that can limit range of motion. And those things are different for each person. So we don't necessarily keep getting more flexible the more we practice. A lot of these conditions are fixed in the human body, and it's not important to be flexible anyway to do yoga asana. It's a common misconception. But there are ways that we can become more flexible, and sometimes it is desirable. Another major factor in range of motion is how often the joint is taken to its maximum range of motion. Repeated experiences of the maximum range of motion increase the amount of movement that the nervous system will allow without pain at a joint. So practicing increasing flexibility regularly will allow the nervous system to facilitate that increase in range of motion. So how far you go into a pose should be well instructed by the teacher that you go to. This is one of the things to look for when you're choosing a teacher, that they tell you how to go to the point, which in this methodology is called the Tapas Point. The Tapas Point is during the practice of asana, the point that you're guided to when there's a certain range of depths in a pose, where everybody may be going more or less deeply than the person next to them into the pose, where you're told where to stop that will best serve to strengthen your weak areas and open tight ones, while learning how and where to work. So if you go to a certain depth in any pose, and the instructor should be able to competently instruct you to that depth, whatever the limitation is, whether it's range of motion, strength, or skill, you will address it at the Tapas Point. One of the ways that you become more skilled when you work in a focused way in the body is that you develop a keener sense of proprioception. So proprioception is the awareness in an organism of the position and movement of all parts of the body. And while there's certain things that we're all quite aware of, like what the position our hand is in, there are other areas of the body that you may not be so attuned to, like the back, the upper back, and the face, and the breath. And you'll get more and more sensitive to knowing the position of these things the more you practice in this way. So a good teacher will take you to a certain range of depth where limitations in strength, limitations in range of motion, or limitations in skill, or a combination of those, will be addressed as they need to be. So let's go through some basic parts of the human anatomy that will be helpful for you to understand before you go to your first yoga class. The first is joints. Joints are where bones of the body come together. And because we're doing these poses that have particular shapes, joints are important because the shapes the body takes in asana are determined entirely by joint position. So a joint is where skeletal movement happens. It's where bones meet other bones, and those places are called joints. So a joint is a structure at which two bones come together. You have some different types of connective tissue in each joint, and the three major types are cartilage, which is sort of padding between the bones, and you can see here some cartilage in the knee. Another type of connective tissue is ligament. Ligament is fibrous connective tissue that connects bone to bone. And you can see some examples of ligament here. And then the third is tendon. So tendon is fibrous connective tissue that connects muscle to bone. And you see some examples near the knee and the shoulder and the elbow here. We don't really want to stretch that connective tissue. Rather, Flexibility is increased, if it's desirable, by increasing the length that a muscle will go to. So let's look at muscles, because muscles are the main force that change the shapes of the joints. Muscles are contractile tissues. That means that when they're active, they can get smaller or contract. So each end of a typical skeletal muscle is attached to a different bone. When the muscle contracts and gets smaller, that contraction brings the two bones that it is attached to closer together. When the muscle relaxes, the two bones can move apart again. So this is how we change joint position using direct muscular control. So if you're trying to move the body into a certain position, consider which bones you're trying to bring toward each other and contract the muscles that cross the meeting point of those two bones, the joint where they meet. Other ways to affect joint position, though, in addition to direct muscular control that we just went through, are gravity. So by folding forward while standing, some of that fold would happen simply by the weight of the upper body being drawn down by gravity. There can be an external force, like a teacher helping you, or using a strap, or some other device to change the shape of the body that's not gravity or muscular control. We also use leverage to shift joint position. Oftentimes it's leverage from another part of the body, so not direct muscular control. And finally, time is another thing that can affect joint position. Simply by holding something for a longer amount of time, the joint position will change. But the one that you'll refer to the most, and the one that requires the most instruction and is most helpful in a yoga practice, is understanding direct muscular control to shift joint position. So in the next lesson, we'll look at some specific parts of the body to prepare you for your first yoga class.